Hello, today we will discuss what is osteoporosis, its signs and symptoms, and its treatment. High salt intake is a risk factor for osteoporosis because excess dietary sodium promotes urinary calcium loss, leading to calcium loss from bone and therefore decreased bone density. Dr. Joel Foreman says it. I am Dr. Jagajit Singh Virk, MBBS, FCGP, FAMS, PGDGM. Now let's discuss what is osteoporosis. Osteoporosis occurs when the creation of new bone doesn't keep up with the loss of old bone. That may be due to excess estrogen, human growth hormone, and maybe due to testosterone. Osteoporosis is a disease that thins and weakens the bones. Bones become fragile and fracture easily or breaks easily. Bones in the hip, spine, and wrist are more vulnerable to fractures. Osteoporosis is a silent disease because there may not be any signs or symptoms of the disease. One may know only when there is a sudden fracture of the bone. You might not know you have it until you break a bone. A bone mineral density test is the best way to check your bone health frequently after certain age. This is the diagram or picture of bone matrix. Bone is a living or growing tissue that changes throughout the lifespan. For your information, a whole bone modulates every 11 months to a new bone. So always there is regeneration and destruction of the bone going on. Stages of osteoporosis. Sorry. Peak bone density and the first stage. It occurs once the rate of new bone being remodeled by osteoblasts is greater than the rate of breakdown via the osteoclasts. Between the age of 30 to 35, and in many individuals from 25 to 30, the rate of bone deposition slows down to be almost equal to the rate of breakdown. This state of equilibrium may be considered the first stage of declining bone mineral density, a process that's called as leaching. Because now the formation of bone is stopped and breakdown and regeneration becomes equal. The second stage of osteoporosis and osteopenia, between the age of 25 and 35, the rate of bone breakdown eventually outweighs the rate of bone deposition. Bone loss begins to occur approximate rate of 0.25% a year. Variable depending on many genetic environmental factors. This may be considered the second stage towards osteopenia and or osteoporosis. Important to understand that perfectly normal part of the aging process. However, unlike discovering your first wrinkle or a few stray gray hairs, the age-related changes of bone not visible. It is also important to note that just as some individuals may have more gray hair or more wrinkles at an earlier age than others, the rate of bone loss can also vary depending on our genetic makeup as well as environmental and dietary factors. The third stage of osteopenia and osteoporosis, age of 45 to 55, the breakdown of bone occurs at a faster pace in women. Effects of menopause are there and associated reduction in the hormone estrogen levels is there. It's important in maintaining the health of all body tissues, including bone. That's why estrogen is very, very important hormone. It including bone, muscle, ligaments, and tendons. And all these health is maintained by hormone estrogen. Women may lose as much as 10 to 20% of bone density around the 5 or so years of menopause. Some may lose as much as 30% of their bone mass. It is not uncommon for women to lose up to 2% of bone mineral density a year during menopause, every year. Men undergo similar changes in bone density around the age of 60 to 65, experience a decline in the hormone testosterone. That is the result of that. This period of hormone-related changes may be considered the third, more vulnerable stage of reduced bone density. Associated with this third stage is an increase in fragility fractures because of stress on the bone, previously considered normal in younger years, may now be enough to cause a fracture. Tripping over a pet, banging into a door, running more than usual, or even bending forward to pick up something heavy like a bucket of water may create enough stress to cause a fracture because the impact is greatest. The fourth stage of osteopenia and osteoporosis, without any intervention, progress to stage 4. During this stage, the effects of significant bone loss becomes visible. Softening of the bones and accumulated fragility fractures, especially in the spine, results in deformity. Anterior wedging of the vertebral bodies of the spine causes the rounded bent over appearance, which is called kyphosis. Associated with the deformity is pain and more difficulty managing normal activities of daily living, such as getting into and out of a car, chair, or bed, climbing stairs, hanging out, washing and reaching overhead, etc., are the few of the daily routine activities which may cause these fractures. Risk factors. Anyone can develop osteoporosis, but it is more common in older women. Risk factors include hormone deficiency, because in female hormones are more vulnerable. Thyroid hormone, hypothyroidism, or parathormone, these deficiencies are the risk factors. Getting older is also a risk factor. being small and thin, having a family history of osteoporosis, taking certain medicines of seizures, epilepsy, or GERD, cancer, transplant rejection medicines, or aluminum hydroxide for gastritis. Being a white or Asian woman are more vulnerable, having low bone density, dietary factors, when there is calcium is low, or there are eating disorders uh, due to malnutrition, and GI surgery where the portion of intestine is removed. Medical conditions like celiac disease, kidney disease, inflammatory bowel disease, cancer, multiple myeloma, rheumatoid arthritis, and lifestyle choices, because where sedentary habits are prominent, excessive alcohol or tobacco use is also a risk factor. Signs and symptoms. There typically are no symptoms in the early stages of bone loss, but once your bone have been weakened by osteoporosis, you might have signs and symptoms that include back pain caused by a fractured or collapsed vertebra, giving you a kyphosis, loss of height over time, stooped posture, a bone that breaks much more easily than expected, and the receding gums from the teeth. What foods destroy bone density? Excess salt, hydrogenated oils, alcohol, food rich in vitamin A, soft drinks, dairy products. Prevention of osteoporosis. Benefits of exercise. It's never too late to start exercising. For postmenopausal women, regular physical activity can increase your muscle strength, improve your balance, decrease your risk of bone fracture, maintain or improve your posture, relieve or decrease pain, avoid high-intensity exercises, jumping, running, jogging. All these should be avoided. Avoid bending and twisting on the spine. Complication of osteoporosis. Breaking a bone is a serious complication of osteoporosis in older patients. Osteoporotic bone breaks are most likely to occur in the hip, spine, and or wrist, but other bones can also be involved. In addition to causing permanent pain, osteoporosis causes some patients to lose height. When osteoporosis affects vertebrae, it often leads to a stooped or hunched posture, kyphosis. Osteoporosis may limit mobility, leads to feelings of isolation or depression, psychological problems. Additionally, 20% of seniors who break a hip die within 1 year from either complications related to the broken bone itself or the surgery to repair it. Many patients require long-term nursing home care after a fracture. Which fruit is best for bones? Food rich in vitamin C, such as oranges, orange juice, bananas, plantains, prunes, grapefruit, strawberries, papaya, pineapple, and guava. Fruit juices that contain calcium and vitamin D fortified. Fruits rich in vitamin K, such as blueberries, raspberries, plums, grapes, and figs, are good for bones. Which nuts are good for bones? Most nuts and seeds boast an impressive nutrient profile, but a select few are especially good for combating bone degeneration. Macadamia nuts, walnuts, hazelnuts, almonds, sesame seeds, pumpkin seeds, and sunflower seeds contain calcium, magnesium, and zinc, and other essential nutrients for regeneration or health of the bone. How is osteoporosis diagnosed? Bone mineral density BMD tests are also known as dual energy X-ray absorptiometry, DEXA or DXA scans. These X-rays use very small amounts of radiation to determine how solid the bones of the spine, hip, or wrist are. Regular X-rays will only show osteoporosis when the disease is very far along. All women over the age of 65 should have a bone density test. The DEXA scan may be done earlier for women who have risk factors for osteoporosis. Men over age 70 or younger, men with risk factors, should also consider getting a bone density test. Can osteoporosis be treated naturally? Healthy lifestyle choices such as not smoking or misusing substances also decrease your risk for this osteoporosis. Vitamin supplements that contribute to bone health, such as vitamin D, calcium, and vitamin K, should also be a staple in your diet to avoid bone weakness later in life. Supplements of vitamin C in high doses, vitamin D 8,000 to 10,000 units daily, vitamin K up to 100 microgram, vitamin B complex, protein 1 gram per kg daily, calcium 1000 to 1200 milligram daily, magnesium 350 to 450 milligram daily, zinc 50 milligram daily, boron 3 to 6 milligram. All these supplements help maintaining the health of the bones. Always inform your doctor before beginning any alternative medicine or therapy. There may be interactions between herbs and the medications you are currently taking. Your doctor can help coordinate an overall treatment plan that best suits your needs. Red clover is thought to contain estrogen-like compounds. Since natural estrogen can help protect bones, some alternative care practitioners may recommend its use to treat osteoporosis. Soy, the soybean used to make products like tofu and soy milk, contain isoflavones. Isoflavones are estrogen-like compounds that may help protect bones and stop bone loss. Black Hosh. Black Hosh is an herb that's been used in Native American medicine for years. It also has been used as an insect repellent. It contains phytoestrogens, estrogen-like substances that may help prevent bone loss. A 2008 study found that black Hosh promoted bone formation in mice. Horsetail. Horsetail is a plant with possible medicinal properties. The silicone in horsetail is believed to help with bone loss by stimulating bone regeneration. Recommended by some holistic doctors as an osteoporosis treatment, horsetail can be taken as a tea, tincture, or herbal compress. It can interact negatively with alcohol, nicotine patches, and diuretics. And it's important to stay properly hydrated when you are using it. Acupuncture. Acupuncture is a therapy used in traditional Chinese medicine. The practice involves placing very thin needles in strategic points on the body. This method is believed to stimulate various organ and body functions and promote healing. Acupuncture is often combined with herbal therapies. While anecdotal evidence supports these as complementary osteoporosis treatments, more studies are needed before we know if they truly work. Tai Chi. Tai Chi is an ancient Chinese practice that uses a series of body postures that flow smoothly and gently from one to the next. Studies by the National Center for Complementary and Integrative Health suggest that Tai Chi might promote increased immune function and overall well-being for older adults. It may also improve muscle strength, coordination, and reduce muscle or joint pain and stiffness. A regular supervised routine can help improve balance and physical stability. It may also prevent falls. Melatonin is a hormone that's made by the pineal gland in your body. Melatonin has been touted for years as a natural sleep aid as well as an anti-inflammatory agent. Researchers' trusted sources are now coming to believe that melatonin promotes healthy bone cell growth. Melatonin can be found in capsules, tablets, and liquid form almost anywhere and is considered extremely safe to take. But it can cause drowsiness and interact with antidepressants, blood pressure medications, and beta blockers. So talk with your doctor first. Thank you very much.